Have you ever felt the weight of uncertainty pressing down on your shoulders? The quiet fear that lingers in the back of your mind when your health feels fragile? When the word dialysis echoes like an unavoidable fate? Many people living with chronic kidney disease experience this anxiety, yet few realize that knowledge is the bridge between fear and empowerment. The truth is that chronic kidney disease is not merely a medical condition. It is an invitation to awaken to the power of early action, to take the reins of your own well-being before circumstances dictate your path. When you understand your body, when you learn the rhythms and signs it communicates, you begin to see that dialysis is not always the inevitable conclusion. There is a world of proactive choices, of daily decisions that can shape the course of your life, that can delay or even avoid the intrusive routines of medical machinery. It begins with awareness, with the courage to look at your condition, not as a sentence, but as a signal to transform how you live, how you nourish yourself, and how you engage with the environment that sustains you. The moment you decide to educate yourself, to embrace strategies that are both scientifically grounded and spiritually resonant, you are stepping into a domain where hope is tangible, where fear loses its grip, and where every small choice compounds into significant change. Dr. Mathew R. Weir teaches that patient education and informed decision-making are not mere suggestions. They are foundational pillars that allow the individual to reclaim agency in their own care. In this light, each meal you choose, each habit you cultivate, and each medical recommendation you follow, with clarity, becomes a tool of empowerment, a statement that your life is not defined by limitation, but by the deliberate attention you bring to your health. As you learn to monitor your condition, track the subtle changes in your body, and collaborate meaningfully with healthcare providers, you begin to perceive the rhythm of control that exists, even in situations that once seemed hopeless. It is the quiet realization that proactive management, guided by knowledge and consistency, can shift the trajectory of CKD from reactive treatment to conscious prevention. And yet, this is not merely about physical interventions. It is also about the mental landscape you inhabit. When fear dominates your mind, every symptom feels magnified. Every lab result becomes a harbinger of dread, and the shadow of dialysis looms larger than reality. But when you cultivate understanding, patience, and an empowered mindset, you discover a new relationship with your condition, one in which you are no longer a passive recipient of fate, but an active participant in your own healing. The body responds to care, to attentiveness, to intentional lifestyle changes, and the mind aligns with these practices when it is grounded in clarity rather than panic. This journey is not instantaneous, and it demands resilience, but it is a journey that transforms fear into focus, weakness into strength, and anxiety into actionable insight. With each passing day of mindful living, each conscious choice regarding diet, hydration, stress management, and routine monitoring, you create a buffer against the inevitable uncertainties of chronic illness. There is a poetic symmetry in this process. Just as CKD challenges the body, it simultaneously presents an opportunity to challenge the mind, to rise above despair, and to cultivate an inner discipline that transcends circumstance. Understanding your condition through the lens of education and proactive care illuminates a path that was always there, but often overlooked, revealing that dialysis is not the only narrative, and that your life, your health, and your spirit remain profoundly within your sphere of influence. Imagine standing at the edge of a precipice, where uncertainty and fear converge, and you feel the weight of what could be, the looming possibility of dialysis, the relentless ticking of time, the questions of what if that haunt every quiet moment. Yet within this tension lies the profound truth. The choices you make now have the power to reshape what comes next. Chronic kidney disease, for all its complexity, is not merely a sequence of lab results or clinical milestones. It is a mirror reflecting your capacity to act, to respond with awareness, and to embrace strategies that strengthen your body while calming your mind. The suspense of what might happen can feel paralyzing, but it is precisely in this crucible of uncertainty that courage and knowledge converge to form a decisive edge. Dr. Mathew R. Weir reminds us that understanding the mechanics of kidney health and the interventions available early in the disease allows patients to move from a state of reactive fear to proactive empowerment. Every measurement, every observation, every subtle change in your energy or appetite holds a clue, a guidepost showing where action is needed. It is in noticing the smallest fluctuations, in adhering to lifestyle adjustments, in respecting the limits of the body without surrendering to them, that the suspense of illness transforms into the thrill of agency. There is a delicate balance between vigilance and obsession, between awareness and anxiety, and learning to navigate this space is a masterclass in self-mastery. The truth many overlook is that the human body is profoundly resilient, responding to consistent care in ways that often defy expectation. Yet the suspense remains. What if the disease progresses despite all efforts? What if dialysis becomes unavoidable? These questions, though uncomfortable, are the very mechanism by which you sharpen your focus, heighten your discipline, and deepen your commitment to proactive management. And here lies the subtle revelation. The fear of dialysis, while real, need not dominate your story, because each informed decision, each lifestyle adjustment, and each collaboration with healthcare professionals acts as a shield, a buffer, and a statement of self-determination. There is no magic, no guarantee, but there is profound possibility. Imagine for a moment the power of small, intentional acts repeated daily. Careful attention to diet that supports kidney function, hydration that maintains balance, monitoring that anticipates complications, and stress management that nurtures both mind and body. These are not merely tasks. They are daily affirmations that your health is your responsibility, and within that responsibility lies your freedom. The suspense of chronic illness is not just in what the future may hold, but in recognizing that the future is not predetermined. It is in this space between what is feared and what is actionable that you discover the essence of resilience. The body and mind respond to clarity, to intention, and to the courage to confront uncomfortable truths without succumbing to despair. Dr. Mathew R. Weir's teachings emphasize that empowerment comes from knowledge, and knowledge demands curiosity, observation, and deliberate action. To delay or avoid dialysis, one must learn not only the medical facts, but also the psychological strategies that convert worry into planning, panic into purpose, and uncertainty into disciplined choice. The suspense is not a villain, it is a catalyst, a reminder of the stakes, a test of your resolve, and a call to elevate your consciousness. Within the tension lies potential. The potential to act differently, to live more intentionally, and to seize control over a condition that could otherwise feel uncontrollable. The mind, trained to anticipate catastrophe, must be retrained to anticipate opportunity. The body, challenged by disease, must be supported by routines that respect its fragility while celebrating its resilience. And in the middle of this struggle, there is a quiet, unspoken truth. Every proactive step, no matter how small, compounds into meaningful progress. Each day of education, each conscious choice, each mindful interaction with your health contributes to a larger pattern, a trajectory that could delay dialysis and foster a life of agency rather than resignation. Suspense, then, is not just tension. It is the proving ground of courage, the spark that ignites action, and the reminder that even in the shadow of chronic illness, there is light for those willing to reach for it. The story of managing CKD without dialysis is not a tale of certainty, but a testament to deliberate care, awareness, and the profound influence of knowledge applied consistently. And now, standing on the other side of suspense, we arrive at a place of clarity, where the power to shape your journey with chronic kidney disease is no longer theoretical but tangible. The essence of managing CKD without immediately resorting to dialysis lies not in denying the seriousness of the condition, but in embracing the tools and strategies that place you in control of your life. Every step you take, every habit you cultivate, every piece of knowledge you apply, becomes a cornerstone of resilience. The teachings of Dr. Mathew R. Weir remind us that knowledge is the seed from which empowerment grows, and empowerment is what allows the individual to transform fear into purposeful action. It is not enough to wait for the future to unfold. The true path to well-being is forged through deliberate, informed decisions made today, anchored in the understanding that proactive care can alter the course of disease. Lifestyle modifications, including thoughtful dietary choices, consistent monitoring, stress management, and regular communication with healthcare providers, become instruments of personal agency, shaping the trajectory of your health in ways that many may overlook. There is a profound psychological shift that occurs when you recognize that while CKD presents undeniable challenges, it does not define the totality of your existence. The disease may influence your routines, impose limitations, and require diligence. Yet it also offers a profound lesson in discipline, mindfulness, and respect for the fragility and resilience of the human body. It is in this balance, between recognition of limitation and assertion of capability, that real empowerment emerges. The mind, once ruled by fear of dialysis and anxiety about the unknown, begins to align with the rhythms of intentional living, fostering an inner stability that reinforces physical progress. Imagine each day as a series of small, purposeful acts. Choosing nourishing foods that support kidney function, integrating moderate activity that strengthens vitality, maintaining hydration with awareness, and observing your body with attentiveness. Each of these actions is magnified when performed consistently, creating a cumulative impact that can delay the progression of CKD. What once felt overwhelming becomes structured, manageable, and meaningful. There is a poetic elegance in this process. The fear that once dominated your thoughts is transformed into motivation. Anxiety is converted into curiosity, and the unknown becomes a field of potential. Dr. Mathew R. Weir emphasizes that patient education, self-awareness, and proactive engagement are not optional extras. They are essential elements of effective care. When you internalize this wisdom, you understand that the narrative of CKD is not predetermined by the presence of disease, but is shaped by your choices, your diligence, and your capacity to act with clarity. This realization opens the door to a mindset of mastery, where every decision is deliberate, every intervention is purposeful, and every day becomes an opportunity to cultivate resilience. The journey is neither easy nor linear, yet it is profoundly rewarding. You learn to celebrate the victories, however small, the moments when your health improves, when energy is restored, or when a lab result confirms the benefit of your attentiveness. Each success reinforces the principle that knowledge applied consistently yields measurable outcomes. Even when setbacks occur, they are reframed not as failures, but as lessons, as guides directing you toward adjustments that strengthen your approach. This mindset shift, the shift from fear-driven inaction to knowledge-driven engagement, is the foundation of managing chronic kidney disease without immediate reliance on dialysis. And in embracing this journey, you discover a deeper truth. Health is not a passive state, but an active creation. And within that creation lies dignity, hope, and empowerment. It is the courage to face uncertainty, the discipline to act consistently, and the commitment to lifelong learning that define this path. As you integrate these principles, guided by the insights of Dr. Mathew R. Weir and reinforced by your own experiences, you begin to reclaim a sense of control that is both liberating and sustaining. Remember, your condition does not diminish your value, nor does it dictate your potential. You have the capacity to influence your health through mindfulness, education, and proactive care. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early. Each step you take in learning, each action you implement, contributes not only to delaying dialysis, but also to cultivating a life of resilience, awareness, and empowerment. This journey is yours, guided by knowledge, inspired by hope, and strengthened by your commitment to living intentionally, fully aware that while CKD may shape some aspects of your life, it does not define the entirety of who you are or the possibilities that lie ahead.